Are you too young to have your knee replaced? Well, it really depends more on the extent of the osteoarthritis in your knee. If you have a lot of pain, severe decreases in functioning, you should need to have your joint replaced regardless of your age. If you wait too long, the effectiveness of the surgery is not as high, so you're not going to get the same improvements in pain and function. Now, you also don't want to have it too early in life, if possible, because this means you're more likely to need a joint replacement revision surgery. And these revision surgeries to fix the replacements, because they don't last forever, are less effective, and if you have a revision surgery, it's probably not going to last as long as the initial one did. So if you have a surgery at a young age, you may need multiple revision surgeries. But it's really going to depend on personal factors and the extent of the osteoarthritis in your knee. If you'd like to learn more about this topic, you can read the blog I wrote on Curovate.com.